Hello, everyone, and welcome to Pass on the Grass, the dangers and trends of marijuana use presented by Heart of Iowa Big Brothers, Big Sisters. This is a part of our series of preventative presentations through the Iowa Department of Public Health. We appreciate you taking the time to be with us today. Heart of Iowa Big Brothers, Big Sisters has been here for almost 50 years. We're at 49 right now. And we have operated under the belief that inherent in every child is the ability to succeed and thrive in life. As the nation's largest donor and volunteer-supported mentoring network, Big Brothers, Big Sisters makes meaningful monitored matches between adult volunteers who are bigs and children as littles between the ages of 6 through 18, with the match continuing until the little graduates from high school in Marshall County. We develop positive relationships that have a direct and lasting effect on the lives of children. Topics we will discuss today include what is marijuana, who is using it, the dangers of marijuana use, the many forms of marijuana, how marijuana affects our youth, marijuana use in Iowa, and treatment resources. What is marijuana? Cannabis, or marijuana, is a psychoactive drug from the cannabis plant used primarily for medical or recreational purposes. Marijuana, also called weed, pot, grass, bud, ganja, Mary Jane, and a vast array of other slang terms, is a greenish gray mixture of the dried flowers of Cannabis sativa. Some people smoke marijuana in hand-rolled cigarettes called joints, in pipes, water pipes, sometimes called bongs, or in blunts, which would be rolled in a cigar wrap. Marijuana can also be used to brew tea, and particularly when it is sold or consumed for medical purposes, is frequently mixed into food or edibles, such as brownies, cookies, or candies. Vaporizers are also increasingly used to consume marijuana. Who is using marijuana? Well, this chart will give you a visual of how many people have used or are using marijuana. It sounds like a good statistic to say that 115 million adult people have never tried marijuana. But then when you read on, you will find that over half of the American adult population has tried marijuana at least once in their lives. That's a lot of people. Close to 35 million people are regular users. A regular user means you are using marijuana at least twice a month. This chart shows the United States marijuana use by age between ages 18 to 55. But we also know that there are users younger than 18 and older than 55. The yellow line highlights the number of folks who use marijuana daily. The gray line represents the numbers of those who've used it in the last month. The orange line is for those who have used it in the past year. And the blue line represents those who are lifetime users. There's a significant gender gap in adult marijuana usage. Men ages 18 to 25 are about a third more likely to use marijuana at least once a month compared to women. And men aged 25 and older are twice as likely as women in that age group, according to the 2016 data that we have here for you. The racial gap in marijuana use is more narrow. About 17% of Blacks, 14% of whites, and 13% of Hispanics ages 18 and older say that they have used marijuana in the past year. However, whites were the most likely to ever tried marijuana, with 53% of whites, 45% of Blacks, and 34% of Hispanics age 18 and older who have tried marijuana. Marijuana will negatively affect many of the major systems in the body. The first we will look at is the cardiac system. Marijuana increases blood clotting. It also increases the heart rate and causes blood pressure to rise, which can increase the risk of heart attacks and arrhythmia. More than 2 million Americans with heart disease currently use or have used marijuana. Smoking marijuana will greatly affect your neurological system. Marijuana overstimulates the THC receptors in the brain, which results in a change in sensations, a change in a person's perception of time. It impairs the thought process, and it impairs muscle control. It can also lead to psychiatric complications. Two of those big ones would include psychosis and delusions. Psychosis is when a person loses touch with reality. Delusions is when maybe they have a very strong but mistaken belief, such as paranoia, where they feel like somebody might be following them or that they think that they can fly. Marijuana will also affect your respiratory system. Smoke in any form can harm the respiratory system. Research has linked marijuana smoking to bronchitis, increased coughing and phlegm production, and unfortunately, cancer as well. Marijuana smoke affects the lungs just like tobacco smoke would, but marijuana smokers have a bit of a different technique. Most marijuana smokers tend to inhale deeper than tobacco smokers, and they hold their breath in longer. This leads to a much more intense and richer exposure of tar in their lungs. It also gives them a quicker high. Marijuana can be used in a vast array of forms. It can be smoked or inhaled through homemade cigarettes or called joints. It can be smoked or inhaled through cigar buds, smoked or inhaled through water pipes, or what we would call bongs. It can also be vaporized or inhaled as an aerosol. That's commonly referred to as vaping. All of the pictures on this slide make logical sense. They look like drugs. How about these? The pictures on this slide are much more misleading. They are edible and drinkable marijuana products. Marijuana oil can be baked into goodies, such as cakes and brownies. There are candies that contain marijuana oil, such as chocolates and gummies. The problem is that it's easy to overdose because who can stop at just one? Marijuana oils can be added to beverages of all kinds, from soda pop to energy drinks. Marijuana can also be applied directly to the skin, being absorbed into the bloodstream. There are flavored marijuana sprays that can be sprayed directly under the tongue for a quick high. These sprays or tinctures are also sprayed on marijuana joints or blunts for an extra kick. Teenage marijuana use is at its highest level in 30 years. Today's teens are more likely to use marijuana than tobacco. Many states allow recreational use of marijuana in adults 21 and older, but it's illegal in 50 states for youth to use marijuana recreationally. Today's marijuana is not the marijuana from years past. That LSD the Beatles were smoking when they created Yellow Submarine doesn't compare to the marijuana of today. Currently, marijuana contains 2 to 3 times more THC than it has in past years. THC stands for tetrahydrocannabinol, and it is the chemical in marijuana that makes you high. Despite the rising THC levels, the CBD level has remained the same, staying at a mere 1%. CBD stands for cannabidiol. CBD is the part of marijuana that is being used for medicine in some places. Because of its presence in the medical field, many teens believe that it's natural and far less harmful than it really is. As we talked about on previous slides, marijuana can come in a lot of different forms. It makes it very difficult for parents to detect their children's usage and struggles with the drug. Some of the warning signs of marijuana use for youth include acting very silly to an unusual degree which could be an effect of marijuana usage. Kids seem to come unglued and act very foolish. Irritability might be another effect of the drug. Who hasn't ever seen an irritable teenager, huh? It might be a normal hormonal swing, or it might be a sign of something else that's going on. Sometimes when using marijuana, teens can lose interest in things that used to captivate them. They lose their motivation to do and enjoy usual activities. Marijuana might even cause them to pull away from their family and friends, or even that they may seem not to care about things that they would have normally cared about. A few more things to look for. Red eyes, looking washed out and tired. Could be from a late night, but it could be something different. Binge snacking, doing lots of eating and snacking outside of usual eating times. Sometimes the youth will hide their stash of goodies, so it's not to tip off their parents. Could be a growth spurt, but could be something more serious. And another thing to take note of is cash flow. If your teen has tons of cash that cannot be accounted for, or you find cash missing from your wallet or purse, this would be something to look out for. If talking to a teenager about marijuana seems like climbing a gigantic mountain, here are some little steps to help you to move forward. Ask what they've heard about marijuana. Be careful to listen patiently. Don't be distracted and try not to interrupt. Avoid your own negativity and anger. Offer facts about the risks of using marijuana. We discussed a lot of these risks previously, and remember, this presentation would be available if you're interested. You just need to call our office. Go back and reference these things that we've talked about. Maybe even if interested, you may have them sit and watch this presentation. Offer up your own experience about drug use. This one's kind of hard for us as parents, guardians, or mentors, but could be the most powerful. Be honest about temptation and pressure. Be careful not to minimize the dangers, and be open about the negative consequences you may have experienced, how it can negatively impact your life or the life of someone you love. The recreational use of marijuana is illegal in the state of Iowa. However, the use of CBD oil is legal. Remember, CBD is the cannabidiol part of the plant that is being used to treat all kinds of ailments. These ailments include anxiety and depression, pain relief, and even helps alleviate some cancer symptoms. There is a great deal of research being conducted as to what benefits this part of the plant can provide. In July of 2020, a law went into effect that included amendments to Iowa's already existing medical cannabis program. These amendments included removing the 3% THC limit on products and replacing it with a 4.5% THC per 90-day purchase limit. There were exceptions for this rule for the terminally ill or based on the patient's healthcare practitioner's recommendations. The Iowa Department of Public Health is now responsible for issuing registration cards as opposed to the Department of Transportation. Dispensaries will be required to employ a pharmacist or a pharmacy technician. Felony disqualifiers were removed for patients and primary caregivers that had convictions related to controlled substances. And the limit on the number of medical cannabis board meetings allowed each year has also been removed. The table here will show you the percentage of youth who have reported using in the past 30 days using marijuana. And what it looks like here is by grade levels for 6th grade, 8th grade, and 11th grade in 3-year timeframes, comparing the state of Iowa to the Marshall County numbers that we have. As you can see, the state of Iowa and Marshall County have similar themes. The data shows a peak in usage in the year 2018, and most specifically in 8th graders. If you look at, there is also a drop in usage for the 11th graders in Marshall County. Unfortunately, data like this is a bit behind. I think, without seeing specific numbers, we are likely to see those numbers go back up, given the 2020 was the start of the pandemic. So online and hybrid at-home learning could be a catalyst for marijuana usage, and we will wait to see how this next round turns out. What is the best way to know if your child is struggling with a marijuana addiction? The answer is talk to them. It may seem terribly daunting to discuss topics like this with your child or a young person in your life. Start these discussions in late grade school or early middle school. Keep the dialogue going. It is our job as parents, guardians, and mentors to annoy them and make them feel uncomfortable now and then. It's one of the many ways that they know we care. How can you help yourself, a friend, or a loved one struggling with marijuana addiction? The most effective way to help is to encourage them to seek help through a professional. Locally, you can reach out to SATUSI, which stands for Substance Abuse Treatment Unit of Central Iowa. They will provide an assessment and referral information. You can also call the number 211 for local information. You just need to give them your zip code and what information that you are looking for. Another great resource for help, and the reason we are providing these important prevention trainings, is the Iowa Department of Public Health. Their funding helps support youth mentoring so that we can serve Marshall County youth the way that we do. Your Life Iowa website is fabulous for resources and information in the areas of alcohol, drugs, gambling, suicide, mental health, and vaping and e-cigarettes. According to a website called canatechtoday.com, this is dated July 11th of 2019, there are 7 documentaries that could give you a comprehensive look at cannabis. With the growth of the cannabis industry comes a growth in a cannabis media. And with so many people eager to learn more, this young and burgeoning space, Cannabis documentaries are popping up all over the place, helping to educate the masses on everything from medical marijuana and the business behind cannabis to legislative issues and cultural phenomena. If you are looking to learn more about the wide world of cannabis, here are 7 documentaries that you should watch. I have not personally watched them, but I find myself always looking for great resources to continue learning and educating myself on topics less known to me. Of course, I would highly recommend that you watch them first without a youth around. And then, if you find it appropriate, sit down and watch it together. You might find that youth in your life are more receptive when it comes in a platform such as a documentary. As always, I want to thank you for joining us. I hope that you have learned more about the dangers and trends of marijuana. I will also provide this presentation if you would like to contact me by calling our phone number listed here, or emailing me directly. And have a good day.